If you are over 60 and climbing stairs has slowly turned into something you avoid, something that makes your knees ache or your legs feel weak and uncertain, then stay with me for a moment because what I am about to share may completely change how your body moves. Imagine this scene. You are standing at the bottom of a staircase. Maybe it is the staircase in your own home, or perhaps at a friend's house, a clinic, or even at a place of worship. You look up at those steps and something inside you hesitates. Not fear exactly, but a quiet doubt. Your knees feel stiff, your thighs feel tired before you even start. You grip the railing a little tighter than you used to, and as you begin climbing, you notice that every step demands more effort than it once did. Halfway up, your breathing is heavier and your legs feel as if they are carrying twice their weight. If this sounds familiar, I want you to know something very important. What you are experiencing is not simply aging, and it is not necessarily permanent. In fact, many people over the age of 60 struggle with stairs not because their joints are damaged or because their heart is weak, but because of something far more subtle that happens quietly inside the muscles themselves. After the age of 50, the body begins to lose muscle mass at a faster rate. Scientists call this process sarcopenia, and it affects nearly every adult to some degree. But the muscles most affected are the ones that play the biggest role in climbing stairs: the quadriceps at the front of your thighs, the glute muscles that power your hips, and the small stabilizing muscles along the sides of the hips that keep your body balanced when you stand on one leg. When these muscles gradually weaken, the body loses its ability to generate the upward push needed to climb a step. At the same time, the ability to control your body while stepping down also decreases. This combination is why so many people begin to feel that stairs have suddenly become a challenge. But here is the part that many people never hear from their doctor. Research in aging and physical activity has shown that this decline is not only preventable, it is often reversible. In controlled studies involving adults in their 60s and 70s, scientists discovered that specific strength movements targeting these key muscles were able to restore stair climbing ability in just a few weeks. And one of the simplest routines ever studied comes from a physician in Japan who continued practicing medicine well into his later years. Over decades of working with older adults, he noticed a pattern. The patients who maintained their ability to climb stairs all shared one common habit. They performed a very small set of targeted movements every day, movements that required no gym equipment, no complicated machines, and no long workouts. In fact, the most important exercise in this routine takes less than 2 minutes to perform. And yet, when practiced consistently, it can rebuild the strength your legs need to lift your body step by step again. Today I want to show you exactly how it works, because the muscles that help you climb stairs are far more capable of rebuilding themselves than most people realize. The body may grow older, but the muscles still remember how to become strong. And the moment you begin activating them again, remarkable changes start to happen. Before learning the exercise itself, it helps to understand something important about how the body actually climbs stairs. Most people assume the movement comes mainly from the knees. When their knees begin to ache or feel weak, they believe the joint is wearing out. But in reality, the knee is only part of the system. The true engines of stair climbing are the large muscles surrounding the hips and thighs. When you step onto a stair, your quadriceps contract to lift your body upward, while your glute muscles generate the power that pushes your hips forward and upward. At the same time, smaller muscles along the outer hip stabilize your pelvis so you do not lose balance when all of your weight shifts onto a single leg. If any one of these muscles becomes weak, the body begins to compensate. You may lean forward more than usual, you may pull on the railing to help lift yourself, or you may start taking stairs slowly, one step at a time. Over months and years, this pattern gradually reduces muscle activity even more. When muscles are used less, they become weaker, and when they become weaker, people avoid the activity even more. It becomes a cycle. But the human body is remarkably adaptable. Muscle tissue responds quickly when it is stimulated again, even in people in their 70s and 80s. Research has repeatedly shown that muscle fibers can grow stronger within weeks when the right movements are performed regularly. This is where the 2-minute exercise comes in. The movement may look simple, but it activates the exact muscles responsible for stair climbing. More importantly, it teaches those muscles to work together again the way they once did naturally. To begin, all you need is a sturdy chair. Sit toward the front edge of the chair so your feet are flat on the floor about shoulder width apart. Slide your feet slightly back so that your ankles sit just beneath your knees. Keep your chest tall and your back relaxed but straight. Now place your hands gently on your thighs or extend them forward if you feel stable. From this position, slowly stand up. Do not rush the movement. Focus on pressing your feet firmly into the ground while your thighs and hips lift your body upward. Imagine that the power is coming from the muscles in the front of your thighs and the muscles in your hips working together. When you reach a fully standing position, pause for a moment. Then slowly lower yourself back down into the chair. This part is very important. Instead of dropping quickly, take about 3 seconds to sit down. Allow your muscles to control the descent. That slow lowering activates what exercise scientists call eccentric muscle contraction, which is one of the most effective ways to rebuild strength in aging muscles. Stand again, then sit slowly. Each repetition strengthens the muscles responsible for lifting your body onto a stair and controlling your body when stepping down. Performing just 10 of these slow repetitions takes roughly 2 minutes. And yet, this simple movement can begin reawakening the very muscles that many people assume have permanently weakened with age. At first, the movement may feel surprisingly challenging, especially if your legs have not been working these muscles regularly. That is completely normal. In fact, many people notice something interesting during the first few days of practicing this exercise. The muscles at the front of the thighs begin to feel warm or slightly tired. That sensation is a good sign. It means the quadriceps are finally being activated again. What is happening inside the muscle fibers during these small movements is quite remarkable. As the muscles contract to lift your body, tiny mechanical signals travel through the muscle tissue telling the cells that they need to adapt to this demand. In response, the body begins producing more of the proteins that build muscle strength. Over time, this process increases the muscle's ability to generate force. That means each step you take becomes easier because your muscles can support your body weight more efficiently. But the benefits go even further. When you practice standing up and sitting down slowly, you are also training your nervous system. The brain and muscles communicate through a network of nerves that control balance and coordination. When this communication becomes stronger, the body learns to stabilize itself more effectively while shifting weight from one leg to the other. And that is exactly what happens during stair climbing. Every step requires your body to balance briefly on a single leg while the other leg moves upward. Strength alone is not enough. The muscles must also coordinate smoothly. This is why many physicians and physical therapists recommend variations of the sit-to-stand movement for older adults. It strengthens the legs while also restoring confidence in the body's ability to move safely. Consistency matters more than intensity. Performing this movement once or twice per day is far more effective than attempting a long workout once a week. Muscles respond best to regular signals that tell them they are needed again. Many people begin with 5 repetitions in the morning and 5 in the evening. Within a week or two, they often find that 10 repetitions feel easier. Gradually, the muscles regain endurance and the body begins to move more naturally. But there is another important piece of the puzzle that many people overlook. Even if your muscles are becoming stronger, climbing stairs can still feel difficult if your body position is working against gravity. Small adjustments in how you move can dramatically reduce the effort required for each step. And this brings us to a technique that older physicians in rehabilitation clinics often teach their patients, something surprisingly simple that can make stairs feel easier almost immediately. Most people climb stairs in a way that unintentionally makes the movement harder than it needs to be. When they approach a step, they keep their body upright or even slightly leaning backward while lifting their foot onto the next stair. Without realizing it, this position places much of their body weight behind the step they are trying to climb. When that happens, the leg muscles must fight against gravity to pull the body upward. The result is that every step feels heavier and more tiring. Instead, a small change in body position can make the movement far more efficient. As you step onto a stair, allow your torso to lean slightly forward from the hips, not a large bend, just a gentle shift so that your weight moves over the front foot. This places your center of gravity directly above the step you are climbing. When the body is aligned this way, gravity actually assists the movement instead of resisting it. Your leg muscles can push upward more effectively, and the step begins to feel lighter. Rehabilitation specialists often teach this technique to patients recovering from surgery or injury because it reduces strain on the knees and distributes the effort more evenly across the hips and thighs. Combining this posture adjustment with the sit-to-stand exercise creates a powerful combination. The exercise strengthens the muscles needed for stair climbing, while the posture change allows those muscles to work more efficiently. There is one more exercise, however, that complements the routine and targets a muscle group many people have never heard of but rely on every time they climb stairs. Along the outer side of your hip lies a muscle called the gluteus medius. Its job is to stabilize your pelvis when you stand on one leg. Without it, the body begins to sway or lean during walking and stair climbing. Weakness in this muscle is one of the main reasons people feel unsteady on stairs. Fortunately, strengthening it requires only a small movement. Stand beside a countertop or wall for balance. Lift one foot a few inches off the ground while keeping your body upright. Hold this position for about 5 seconds, then gently place the foot back down. When you stand on one leg, the gluteus medius on the supporting side activates to keep your pelvis level. Holding the position trains this stabilizing muscle to become stronger and more responsive. Performing this balance hold 5 to 10 times on each side takes less than a minute, yet it awakens a muscle that plays a crucial role in stair stability. As these muscles regain strength, something remarkable begins to happen. The stairs that once felt intimidating start to feel manageable again. Another reason stairs can feel difficult as we grow older has less to do with climbing up and more to do with coming back down. Descending stairs requires the muscles of the thighs and hips to control the body's weight as it lowers toward the next step. This is a demanding task because the muscles must lengthen while still producing force. Scientists call this eccentric strength, and it is one of the most important abilities for maintaining safe movement later in life. When eccentric strength weakens, people often feel a sense of instability while stepping down. The body may drop quickly onto the next step or rely heavily on the railing for support. Fortunately, the sit-to-stand exercise already trains this ability every time you lower yourself slowly into the chair. That controlled descent is essentially the same muscle action used when walking downstairs. But you can enhance this effect with a simple step-down practice once your legs feel stronger. Stand on the bottom step of a staircase while holding the railing lightly for balance. Keep one foot planted firmly on the step. Slowly lower the opposite foot toward the floor until your heel gently touches the ground. Then press through the standing leg to lift the foot back up onto the step. The key is to move slowly and maintain control during the lowering phase. This movement teaches the thigh muscles to regulate your body weight as it descends, just as they must do when walking downstairs. Many people begin with 5 repetitions on each leg. Over time they gradually increase to 10 or 15 as the muscles adapt. When practiced alongside the 2-minute sit-to-stand exercise and the one-leg balance hold, these movements form a small routine that activates nearly every muscle required for confident stair climbing. What makes this approach so powerful is its simplicity. You do not need machines. You do not need long workouts. You only need a few minutes of consistent practice. Within several weeks, many people begin to notice subtle changes. Standing up from a chair feels easier, walking feels smoother, and when they approach a staircase, the hesitation they once felt begins to fade. The body remembers how to move. It simply needs the right signals to remind the muscles that their strength is still needed. One of the most encouraging discoveries in modern aging research is how responsive the body remains even in later decades of life. Muscle tissue is far more adaptable than many people realize. Studies of adults in their 70s and 80s have shown measurable increases in leg strength after only a few weeks of consistent training. This means the muscles responsible for climbing stairs are not permanently lost with age. They are simply waiting to be activated again. When you perform the sit-to-stand exercise each day, you are sending a powerful message to those muscles. You are telling the quadriceps, the glutes, and the stabilizing muscles of the hips that they are needed again. In response, the body begins rebuilding strength, coordination, and endurance. At the same time, practicing balance on one leg awakens the smaller stabilizing muscles that prevent the body from swaying during stair climbing, and the slow step-down movement teaches the thighs how to control your body safely when descending. Together, these movements recreate the exact muscle patterns used when walking up and down stairs. Many people who follow this routine begin to notice improvements sooner than they expected. Within a few weeks they may find that rising from a chair requires less effort. Their steps feel steadier. Their confidence grows. Eventually the staircase that once felt like an obstacle begins to feel familiar again. But perhaps the most important change is not just physical. Regaining the ability to climb stairs restores a sense of independence. It allows people to visit loved ones without hesitation, to move freely through their homes, and to feel confident in their own bodies again. Aging does not mean surrendering the movements that once felt natural. The human body is designed to adapt, rebuild, and strengthen throughout life. Sometimes it only takes a few minutes a day to remind the muscles how capable they still are. And when those muscles begin working together again, each step upward becomes a little lighter, a little steadier, and a little closer to the freedom of movement that every person deserves to keep.